Hi everyone, welcome back to my YouTube channel, and today we are going to talk about age changes in dental pulp. So let's start our topic with introduction. Dental pulp is soft, vascular and innervated connective tissue located within the pulp chamber and root canals. It plays essential role in both tooth vitality, sensation, nutrition, dentine formation and defense. Unlike enamel and dentine, the pulp is a living tissue that undergoes continuous changes throughout the life. Aging significantly affects the structure, cellular makeup, blood supply, and function of the pulp. Understanding these changes is important for clinical management, especially in restorative dentistry, endodontics, geriatric care, and trauma cases. Structure and functions of dental pulp. First, we will talk about basic components. Basic components of dental pulp include cells, fibers, ground substance, blood vessels, and nerves. Cells include odontoblasts, fibroblasts, undifferentiated mesenchymal cells, and immune cells. Fibers include collagen type 1 and type 3, and also reticular fibers. Ground substance is rich in proteoglycan and glycoproteins. Blood vessels, it is highly vascularized. Nerves are dense sensory and sympathetic nerve supply that is present in the dental pulp. Functions of dental pulp. First is formation, as odontoblasts produce dentine. Second is sensation, as it responds to thermal, mechanical, and chemical stimuli. Third is nutrition, as it supplies nutrient to dentine. Fourth is defense and repair, as it forms tertiary dentine and initiate immune responses. Age-related changes in dental pulp. With advancing age, the dental pulp undergoes significant quantitative and qualitative changes affecting its cellularity, vascularity, innervation, and functional capacity. First, we will talk about structure and morphological changes. Then, we will talk about cellular changes, vascular changes, neural changes, calcification and pulp stones, and also about functional changes. So, first changes in dental pulp that are age-related are structure and morphological changes. It includes reduction in pulp chamber size and changes in pulp shape. First is reduction in pulp chamber size. Continuous deposition of secondary dentine and tertiary dentine reduces the volume of pulp chamber and root canals. Pulp arms become flattened or disappear. The decrease in chamber size is hallmark of aging pulp. Second is changes in pulp shape. Irregular dentine deposition leads to asymmetrical pulp spaces. Calcification may distort the shape further. Second changes are cellular changes. First is decrease in cellularity, second is fibrosis, and third is odontoblastic change. First, decrease in cellularity. Number of odontoblasts, fibroblasts, and undifferentiated mesenchymal cells significantly declines. Reduced cell population weakens reparative capabilities of dental pulp. Second is fibrosis, that is increased fibrous tissue. Collagen fiber increase in number and thickness. Ground substance reduces, leading to a more fibrotic dense tissue. Fibrosis reduces pulp flexibility and metabolic activity. Third is odontoblast changes. Odontoblast layer become irregular or discontinuous. Cell may shrink or undergo degeneration. It leads to slower dentine formation and reduced response to irritation. Third change is vascular changes. It includes reduced vascularity, thickening of vessel walls, and fourth is and decreased pressure. Reduced vascularity. Blood vessel decrease in number and diameter with aging dental pulp. It reduces blood supply. It compromises nutrition and immune response. Second, thickening of vessel wall. Blood vessels in pulp show hyalinization and sclerosis. It slows blood flow and reduces tissue oxygenation. Third is decreased pulp pressure, as lower vascularity results in decreased pulpal hydrostatic pressure, influencing sensitivity and reparative potential. Fourth age-related change in dental pulp is neural changes. It includes decrease in nerve fiber, reduced sensitivity, and altered pain and response. First, decrease in nerve fibers. A reduction in the number of myelinated and unmyelinated nerve fibers. It results in diminished sensory function. Second, reduced sensitivity. Age pulp show less sensitivity to thermal and electrical stimuli. It is clinically significant in assessing pulp vitality. Third is altered pain response. Pain may be duller and slower due to reduced nerve density and slower conduction. Next age-related change in dental pulp is calcification and pulp stones. Pulp stones are also called as denticles. They are common in older individuals. They are classified as true or false denticles depending on their structure. They may be free, attached, or embedded within the dentine. Second is diffuse mineralization. It is irregular calcification formed mainly in the radicular pulp. It occurs along blood vessels or collagen fibers. Consequences of calcification and pulp stone. It can obstruct root canal, complicating endodontic treatment, and it may interfere with the normal nutrient flow of the dental pulp. Six are the functional changes of dental pulp that include reduced separative capacity, diminished immune response, and lower sensory response. Reduced separative capacity. Few undifferentiated cells are there and reduced blood supply that decrease the pulp ability to form tertiary dentine. Older individuals show poor healing after trauma or irritation. Second is diminished immune response as fewer immune cells and reduced circulation slow defense against infection. It increases susceptibility to pulp necrosis. Third is lower sensory response. It reduces nerve supply, result in diminished perception of pain and thermal stimuli. Is because older patients may not detect early caries or pulpitis symptoms. Clinical implication of age-related changes. First is restorative dentistry. As reduced sensitivity may mask early caries, making diagnosis harder. The second, dentine that complicates cavity preparation and depth estimation. Bonding effectiveness may decrease due to sclerotic dentine. Second clinical implication is endodontics, as calcified canal increase difficulty in locating canal orifices and negotiating root canals. A reduced pulp vascularity increases the risk of necrosis after trauma, and excess cavity preparation may require advanced imaging. Third clinical implication is periodontics, as pulp vitality testing becomes less reliable due to decreased nerve sensitivity. Chronic periodontal disease may have greater impact on already compromised pulp. Fourth clinical implication is prosthodontics, as reduced chamber size decreases risk of pulp exposure during tooth preparation. However, each pulp is more susceptible to ischemic damage. Summary of key changes include decrease in pulp volume due to dentine deposition, reduced cellularity and increased fibrosis, diminished vascularity and nerve supply, increased calcification and pulp stones, lower reparative and immune capacity, and reduced sensitivity and compromised vitality responses. Conclusion of this lecture video. Aging significantly affects the dental pulp, resulting in reduced cellularity, decreased vascularity, and diminished nerve supply, and increased fibrosis and calcification. These changes reduce the pulp ability to respond to injury, infection, and restorative procedure. Clinically, the aged pulp poses challenges in diagnosis, endodontic treatment, and overall dental management. And this was all about age changes in dental pulp. Hopefully you liked the video. If you do, don't forget to like, share, subscribe or comment. Thank you for watching.